warahmatullahi wabarakatuh to Miss Jiniwati. My name is Muhammad NURAIDIL FIDZMAN bin MOHTAR. I'm from AM110-4C. My student ID 2020956759. So today, me and my friends would like to explain about the implementation of EKSA in Ministry of Health, Malaysia. Firstly, the introduction of public sector. What is public sector? Public sector is the part of the economy composed by the both public services and public enterprise. For example, public sector including public goods and governmental services such as the military, law enforcement, infrastructure, public transit, public education, and along with the healthcare. Why do we need a public sector? Public sector is a control and operated and run by the government. Mostly, the government own most of the asset and provide all the services. The needs of public sector deals with the production, ownership, sale, delivery, and allocation of budget. The public sector is made up at least three types of organization. The first type of organization is the core of the government. The core government is a governing body with specific territorial authority. It also includes all the government ministry, departments, and branches that are integrated part of the structure that is directly accountable and report to the central authority. The second type of organization is an agency. It is a visibly part of the government and consists of public organization that provide public programs, goods, or services, but it exists as a separate organization. In addition, the organization is a legal entity with the operational independence and functionality. The third type of organization is a public company. Public company is an organization that provides goods, public program, and services, but is operated independently and often has its own source of income in addition to public funding. The next one is a background of the public organization, which is the Ministry of Health Malaysia. The Ministry of Health Malaysia, known as KKM, is a Malaysian government ministry in responsibility of health-related matters affecting the country health and has promised to provide the finest service possible. Public health, medical research, medicine, dental treatment, and many other health-related services are examples of the service provided by KKM to the public. Furthermore, the Ministry of Health was active in the rehabilitation of the social concern and community development during the period. In addition, the government through the Ministry of Health and other play an important role in health development through strengthening the health system and generation of human, financial, and other resources. These allow health system to achieve their goals of improving health, reducing health inequalities, securing equity in healthcare financing, and responding to the population needs. Moreover, the improvement of health outcomes are not attributable to a health system alone, as evidence has shown, but to social, economic, cultural, and environmental determinants also, as reflected in the WHO conceptual framework of health for all. Following the cabinet resignation on the 16th of August 2021, Khairi Jamaluddin was appointed as a new Ministry of Health, and he was assisted by two deputies, which is the first one is Dato' Dr. Nur Azmi Ghazali, and then the second one is Dato' Aaron Agor Dagang. They began on the 27th of August 2021 to provide the best healthcare service for the community under the new normal is in the coming endemic phase of COVID.
My name is NAJIAH binti Abdul Halim, metric number 2020955667. Definition of EKSA. The Public Sector Conducive Ecosystem EKSA was created in January 2014 as a rebranding initiative of the public sector 5S in response to the need to showcase a quality and conducive environment to be more relevant to Malaysia government departments or agencies. EKSA has also been used in the government and business sectors to establish a positive work environment and to preserve a corporate image. In addition to reducing inefficiency in terms of time and space, offers a methodical and practical working environment. Because of the creativity and innovation factor enforced, the implementation of EKSA on a continuous basis in a shift in service delivery technique to a more customer-friendly. As a result, the EKSA assessment has been changed in accordance with the audited agencies. As we know, EKSA that has been identified has a dual purpose. It not only aims to replace the 5S concept that has already been established, but it also aims to improve the 5S concept by empowering workers.
So now I will discuss about the implementation of EKSA. So the first one is creating a committee. So basically EKSA must be implemented in phases, with the first stage, second stage, third stage and fourth stage being the most important. It necessitates meticulous planning, monitoring and improvement. The success of this practice is contingent on top management's involvement as a supporter, as well as teamwork and dedication from all employees. So one of the implementation of EKSA is creating a committee. The responsibilities of the EKSA implementation committee are detailed in the EKSA implementation on framework, and each member of the committee and members must fulfill their responsibilities, because it is normal to form a committee before organizing any activities to guarantee that the activities run smoothly and efficiently. They can make a flow chart of the organization that includes their role, so that everyone can refer to it if they have any queries about EKSA activities. In addition, the head of the EKSA implementation committee is responsible for ensuring that EKSA is implemented correctly.
Assalamualaikum and hi Miss. My name is IZZAH ATHIRAH binti ROSLI with Metro ID 202095023, and I will explain to you about the establishment of EKSA. The Ministry of Health Malaysia also has a policy and objective to ensure the level of productivity, quality and innovation to improve service delivery to consumer. The policy of Ministry of Health in establishment EKSA to be a catalyst to improve the quality of work through services and productive through a friendly, clean, healthy and conducive work environment. This is to ensure that the Ministry of Health can provide the best service to consumer and at the same time be able to achieve the desired objective. There are various reasons why the Ministry of Health establish EKSA in their services. The establishment of EKSA in the Ministry of Health Malaysia is to create a clean, safe, tidy and comfortable work environment always. This is to ensure that the service provided by the Ministry of Health to customer are better quality. For example, the Ministry of Health always sanitize the equipment provided in the department to disinfect, to ensure that the COVID-19 virus is prevented from being on the equipment used by the public. We can see based on that example, the Ministry of Health attach a great importance to hygiene and safety to ensure that the service provided to consumer are safe and comfortable to use. In addition, the establishment of EKSA in the Malaysian Ministry of Health to improve an individual self-discipline. For example, in dealing with the problem of COVID-19 in quarantine center, Ministry of Health always take care of the SOP to prevent further infection. This is closely related to the application of EKSA in the scope of discipline. If the ministry staff is not disciplined in complying with the SOP that has been set, it can allow them to be affected with the COVID-19 virus. Besides, the establishment of EKSA in the Ministry of Health also help increase the level of customer satisfaction with the service offered. It means by applying EKSA, every individual who serve in the Department of Ministry of Health must provide the best service to the customer. According to Nahamida Awang, she was very satisfied with the treatment provided by Ministry of Health when she was undergoing quarantine. From that, we can see by applying EKSA, the Ministry of Health always increase the level of customer satisfaction. Patient satisfaction is an important and commonly used as indicator for measuring the quality in healthcare. Patient satisfaction affect clinical outcome, patient relations, and medical malpractice count. It affects the timely, efficient, and patient-centered delivery of quality health care. Other than that, the establishment of EKSA is also able to create a cheerful and effective work culture in the Ministry of Health department itself. It means by applying EKSA, it can foster the spirit of cooperation that lead to more effective and cheerful in performing tasks and able to give a good impact to the customer. As we know, the Ministry of Health is very busy government department in dealing with the problem of COVID-19 virus. Various burdens that can give effect figure problems such as stress among employees of the Ministry of Health that can lead to various other health problems that can attack them while they are doing their job. According to Datuk Sri Dr. Adha Baba, stress, long working hour are the trigger to the problem of 600 Ministry of Health staff have a psychology problem. With the existence of EKSA, the spirit of cooperation in the management itself, it can overcome the problem that arise. Therefore, the establishment and applying EKSA in the Ministry of Health is very important to achieve the desired objective, and it also able to maintain the image of Ministry of Health Malaysia.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad SHUHAIMI bin SHAMSUL. I am from AM1104C. My ID number is 2020950431. Today I'm going to talk about EKSA zone requirement. There is 4 EKSA zone requirement, which is role of zone head, role of facilitator, role of coordinator, and role of member. First, the role of zone head are to hold regular meeting with zone member. In addition, it also need to formulate the direction and planning plan at the division level. From committees at the division level, identify the coverage of EKSA implementation zone in the division. Help provide guidance and mentoring to the group member. Implement EKSA activity at the division level. Next, implement the cultivity of creativity and innovation as well as saving action. Monitor the implementation of EKSA division and ensure the uniformity of EKSA implementation as outlined at the ministry level. Next, role of facilitator are provide training and guidance to zone head and member and ensure that zone comply with the rule and guideline provide. In addition, the role of the facilitator determine the coverage of the zone in the division and act as an intermediary to deliver the latest information as well as coordinate and monitor activities. Furthermore, role of coordinator are coordinate EKSA program in their respective zone. Disseminate the latest information on EKSA implementation in zone, prepare and update zone file to assist the management of promotional, training and audit activity, and report on the progress and status of EKSA implementation. Finally, role of member are provide continuous commitment in the implementation of EKSA, actively participate in EKSA activity, collaborate in the zone and attend meeting and contribute ideas and the successful implementation of EKSA in the zone.
Before EKSA was formed, the arrangement on the workplace was messy and unorganized. The environment of the workplace before EKSA reform was stressful and makes staff and employees feeling down. We can see a big difference when the EKSA was implemented. It was more organized and give a positive environment. Here are some pictures of example the before and after EKSA were formed.
Improvement of the workplace conductive environment. 1. Office space. Office equipment is always in good condition and can always be used safely. Office equipment is always clean and arranged to look neat and ensure light and electrical plug are always working and labeled according to the suitability of photocopy, fax machine and CPU. 2. Office equipment layout. All office furniture and equipment are neatly arranged, in good condition and do not threaten the safety and health of employees. Creativity in arranging furniture and equipment is encouraged to create a more comfortable and cheerful office atmosphere and does not threaten safety and health, and equipment arrangement technique can shorten processing times. 3. Interior decoration. Decoration that match in image of the department. Simple and economical, maintains and its position does not threaten the safety and health of employees. Corporate information can be displayed, but the excessive in terms of quality and constant update. In addition, dirty wall due to the effect of the pack should be cleaned, and the use of plastic flower decoration and leaf flower is not recommended. Decoration such as landscaping with water feature and aquarium in the office space is not recommended. And make sure all the decoration are not dusty, not dirty, and always in good condition, as not to spoil the view of, and decoration arrangement is always neat, organized, convenient for movement, and does not threaten the safety of worker. 4. Meeting room. Always ensure the floor is clean, not dusty or no dirt. Equipment are in perfect condition and can be used properly. Ensure equipment are always clean, not dusty, and neatly arranged when not in use. Equipment has an inventory and maintenance system. Display inventory list. Information related to the meeting should be displayed at the door. Enter the meeting room. Cooperative decoration can enhance the atmosphere of the room, and there should be regular maintenance. Whiteboard should be cleaned after the meeting is over. Make sure the eraser and the marker pen in red, blue, and black are placed at the place. Provide, and wall clock should be placed in a suitable place. Training room. Clean floor, no dust and no dirt. Corporate style decoration, and there is regular maintenance. Clean and dust-free equipment. In perfect condition and can be used well. Equipment has inventory and maintenance system. Signet facilities. Instruction provide adequate, informative and effective, and a responsible officer must be appointed to manage the cleanliness of the training room. The name and telephone number.
Increase the employees' creativity. To enhance workplace productivity, IPKKM, employees are urged to foster current components of creativity and innovation while they fulfill their individual jobs and responsibilities. For example, the following of activity demonstrate to increase the employees' creativity, such as stationery storage, labeling, and shorten the work process. Firstly, the way to increase the employees' creativity is the stationery storage. The stationery storage in office. Stationery include letterhead, typing, sheet, pencils, carbon papers, files, and folders. A form set used in the office is referred to as continuous stationery. It consists of various forms such as invoice or specific accounting forms, which are produced and delivered in continuous strips. All of this is the basics things must have in the office. Next, the way to increase the employees' creativity is labeling. It can make it more professional. For example, this is to facilitate the search for documents about the client or user. When all the client information has been labeled, it looks more organized on the shelf. It also can make more easier to find out the latest information about the clients or user. Lastly, the way to increase the employees' creativity is it can make shortens the work process. When all the work has been arranged neatly, it can be rolled out for the process to the customer to solve their problem more quickly. This can save time between employees and customers. It is to encourage creative and innovative programs that meet community needs. Also, the best practice for increasing the organization staff efficiency and quality of work is by encourage the implementation. For example, every month they will choose the most creative and innovative staff to be awarded.
The third benefit of EKSA is it could improve workplace standardization. Standardization refers to the state or quality of all products being the same in terms of shape, feature, arrangement, and other characteristics. By using 5W1H, it can ensure effective uniformity in methods, layouts, and standards. The processes also become more predictable, allowing the public servants to better plan them and know exactly how they were set up, how many steps they have, and how long they take. In addition, standardization makes it easier for the public servants because they have a clear blueprint guiding them and allowing them to pick up their tasks more easily and reduces the time needed to find the right replacement components or parts when something breaks. With these benefits, it is clearly shown that the implementation of EKSA is very important for government departments.
Next, I will explain to you about to create tidy and safe work environment. In achieving the objectives set by the Ministry of Health, to create neat and safe work is very important to ensure that customers are satisfied with the services offered and used. Various measures taken by the Ministry of Health in ensuring that they will provide the best service in performing their duties. In performing neat and safe work duties, the Ministry of Health always ensure cleanliness in the hospital is warranted because hospital and clinic are the places where the customer come to receive the treatment. For example, in the pandemic of COVID-19, the Ministry of Health will ensure that the equipment in the hospital or clinic is always disinfected so that it will save to the customer to use it. Therefore, we can see that the Ministry of Health is very concerned about the safety of customers who come to use their services. In addition, in ensuring to create tidiness and safety, the Ministry of Health will reduce the risks of danger in the hospital and clinics in way that they will ensure that the equipment used in store neatly in the right place. For example, they will at the hospital or clinic, they will keep the dangerous equipment such as needle and knife in the right place. This is very important to avoid injury to customer who want to seek a treatment. Furthermore, the Ministry of Health will also ensure the employee productivity will be increased by providing the best service to customer. For example, Ministry of Health staff such as doctor and nurses provide the best service to clients by treating them in a professional manner. This can increase satisfaction to customer as well as it is able to maintain the corporate image of the Ministry of Health itself. In a nutshell, in carrying out to create neat and safe work is very important, especially in the Ministry of Health, because customers who come need a treatment from the professional groups such as doctor, and the Ministry of Health must ensure that it will provide the best service to the customer.
Okay, so the last benefit of EKSA is improved self-discipline and teamwork among MOH staff. So, when you at work, you need to be self-disciplined and work well with others. An excellent work culture can be built by following the rules and standards that have been set up. Every member of the staff should know, follow, and try to keep the workplace clean and organized. Hygiene practice can be taught to someone by giving them help through the training program at regular intervals. For example, through this EKSA program, it can help the MOH staff be more self-disciplined and work better as a team. Self-discipline is important because it gives you the chance to do well at work. It helps you set a work schedule and help yourself accountable for your goals by encouraging you to look for more advanced jobs. Also, the EKSA is a good way for staff to get along and build a good team together. Having a team solve problems, collaboration in group can help solve problems. Brainstorming is a good way for the team to share ideas and come up with the new ways to do things. The best solutions are found when team work together to come up with the best ideas. It's a good thing. Teamwork makes that deadlines are met and there is high quality work. It doesn't matter if one member of the team falls behind. There's always someone else. There's always someone else who can help out. When work is split up among team members, it gets done faster, which makes the whole business run more smoothly. As you work together to achieve a common goal, your team will be formed upon. The MOH staff can be more focused and alert if they use EKSA. When staff follow the EKSA, it can help them become more aware of themselves and be more accountable for the work they do. Employees who have more self-discipline will also not have issue with being late, failing to do what they're supposed to, not knowing what the customer want, and not being clean if they follow the EKSA, which is what they should do in their job, because the EKSA give a clear explanation how to be more responsible, self-disciplined at work and the environment around the MOH staff. They will get better this thing. People who work for the Ministry of Health will be able to improve their self-discipline if they work in an environment that encourages that. This is important because customers and citizens will see how the MOH staff act and respond to them. Teamwork is important because when you work with other people, it can be easier and faster to do something or some work. When you do a job that requires a lot of thought and planning, you can't do it at your own because you need help. That's why it is so important for the staff to work together. You will need help with a job that can done by yourself. When the staff go through the EKSA, they will know how to work together. People who don't work together are different from the people who don't work well together. As soon as the staff have a good team with each other, you will see that they will do the task work that are given faster, properly, and because of the bond and the teamwork are good. There will be no problem or complaints from customer because MOH staff work well together. They don't make a simple mistake that will be make the customer angry and complain about silly things. That means the MOH will be very happy because the staff will leave the customer with a good review. When the MOH staff use the EKSA, they will get a lot of good things and learn a lot. When the staff at the MOH apply the idea of self-discipline and teamwork, it will make the workplace more positive and welcoming. During work hour, the MOH staff will not be stressed because they will be in a good mood. So, self-discipline and teamwork is an important thing to do when you at the work environment. So, from the EKSA, the staff will know how to deal with this kind of thing. So, it will be a better workplace if you apply the EKSA at your workplace.
In conclusion, the public sector conducive ecosystem, also known as EKSA, can be described as a public sector rebranding initiative that emphasizes the importance of a quality and conducive workplace in order to remain relevant. This film is consistent with the Ministry of Health efforts to strengthen the public sector structure culture of high performance and innovations by providing a conducive environment, work culture, and positive value for a public servant, as well as increasing staff productivity. Furthermore, EKSA introduced a number of elements such as a generic and specific criteria that account for a diversity of agency. As a result, implementing EKSA in the Ministry of Health aided management efficiency at the workplace, as Ministry of Health employees were exposed to danger, particularly during the pandemic of COVID-19. Thank you so much.